All right, good afternoon and welcome to the Flint Community Webinar on Coronavirus. Today is Friday, July 15th, 2022. You made it to Friday and we're so glad that you are here and joining us this afternoon. This is our 122nd consecutive webinar, which is brought to you by the Flint Center for Health Equity Solutions, the Healthy Flint Research Coordinating Center, and the Michigan Prevention Research Center. I am Heather Lynn Uphold. I'm filling in for your moderator, Yvonne Lewis. I'm an assistant professor with Michigan State University, as well as a co-director for the Healthy Flint Research Coordinating Center. And I am so excited to be here with you. But we are not alone. We are here with our wonderful partners who join us every single week, not only to answer your questions that you put in the Q&A, so I hope you've got those that are coming in, but also help us understand what's going on in our community. We have some wonderful topics, really important topics that we're going to be talking about today. This includes long COVID. So what happens after you get COVID and the side effects that you might be experiencing. We're going to have someone here talking to us about that. We'll also be learning about different kinds of maps. So cartograms, and I have to tell you, I had to ask Rick Sadler how to say these words. So we'll be learning about cartograms and choropleths, which I might have said wrong, but he'll tell us, and he'll tell us even more why they're important for us and what we should know about them. And then, of course, we will get our wonderful updates from the city of Flint and our partners at the health department. So as mentioned, we do have Dr. Wu, who is here to talk to us about long COVID. She's an associate professor at the College of Nursing at Michigan State University. And we are so glad that she is able to join us here today.
Hello, everyone. Thanks for inviting me to be here today. And my name is Hongshan Wu. And feel free to call me Wu because nobody can remember my first name, so I go by my Wu. First of all, I really appreciate the invitation. It is my pleasure to be invited. And so for the next 10 to 15 minutes, I'm going to talk to you about an ongoing study for long COVID and share with you the latest about what we have learned at this time. You know, COVID seems it's moving target. So there's long COVID. So I just kind of want to share it with you about what we have found so far. Not really, not everything, but the most important information I kind of want to share with you. So I believe I need to share my slide, right? Okay. Can you see my PowerPoint?
Nope, we're just seeing your Zoom.
Oh, okay. So, you know, I have two screens at my office and I'm still learning. I have to say after 2 years. So can you see my screen now?
We do.
Perfect. Can you see my presentation view?
We see your notes.
Oh, you see my notes. Okay, so I have to stop doing that again, I believe. Okay. Can you see my screen now?
It's perfect.
Okay, thank you. Okay, so I am conducting an ongoing study, and the name of the title of the study is called Consequences of COVID-19, Post-COVID Symptom and Management. So I kind of want to start with to bring everybody's memory back to early 2020s. So in early 2020s, when the pandemic first started, I believe no one had thought about COVID-19 can have long-lasting effects. And actually today I'm telling you, possibly become chronic. I know it sounds very scary among those who have been infected. Today, we have come to realize that many infected people across all ages are affected by COVID-19 long after. Unlike common cold or flu that we have all have in our lifetime, once you infected, once you recover, you're okay. But COVID is very different. So first of all, I kind of want to talk about the terminology. So the current definition about post-COVID conditions are those persistent of symptoms or even develop of new symptom more than 4 weeks after acute illness, which is meaning after you're being infected by COVID. So there have been several terms being used to describe post-COVID conditions, such as long COVID, long haul COVID, long hauler, post-acute COVID-19, long-term effects of COVID, or chronic COVID. So there's a lot of different terminology have been used, actually describing the same things. So today I'm going to use the term long COVID to describe those long-lasting or persistent symptoms after the acute COVID infections. So I kind of want to tell you the story behind this study. My research program focuses on cancer symptoms. So I'm an oncology researcher. I have studied breast cancer for most of my career. I have studied symptoms among cancer patients undergoing chemotherapy, as well as cancer survivor after treatment completion. So back in 2020, when COVID just started, and I started noticing some of the COVID symptoms that have been reported on the social media, because at the beginning of the COVID, we did not have much systematic study of COVID symptoms. So if you recall, actually it's coming, like the symptom being discussed is different, like sometime, day by day. And even the CDC, they change the COVID symptom from time to time at the beginning. And I noticed at that time, from the social media, it seems like fatigue, foggy thought, short of breath, and there's so many different kind of symptoms, not many different kind of symptoms. Those COVID symptoms are actually very similar to what cancer patients have experienced during chemotherapy, as well as after, they completed the chemotherapy. So it's kind of inspiring to me. And I feel like, I am a symptoms researcher. I think I can do better job than anybody else. So I was able to gather a study team. Actually, we had quite a few of us, like symptom researchers, get together and start brainstorming the design of this study. And also at that time, although we kind of still try to deal with the acute COVID, we began to wonder, because the similar pattern have been observed, like I'm talking about symptoms, in between COVID patient as well as a cancer patient. And actually, we just kind of recently started to realize cancer survivor experience symptoms as well. So it just makes us wondering whether COVID is going to be becoming long chronic or long lasting. And actually, now we kind of learn, yes, it is true. Because, after a while, we start hearing long hauler. I remember, I got the newspaper talking about long hauler probably a year ago. And actually what we thought, actually it is right. Now COVID become chronic. And that is what we are studying right now. And I'm happy, we kind of did a right decision like a year and a half ago. So that is a story behind this. And just because my background is cancer, so I can associate what we observe in the COVID patient with the cancer patients that we have been studying with. So this study, again, I'm not going to give you a lot of detail, and I try to be more entertaining about, telling you what our study design is. Basically, this is a descriptive study. It's just very simple. We make a phone call. We actually heavily relies on the phone contact. So by the way, our community partner is Barrow Hospital at East Lansing. And so we utilize their COVID registry, and that is how we get the patient's name, and we were able to contact those patients by phone. And after that, we got the informed consent. Of course, we need to consent the patient into any of the human subject research, and we enroll the patient into our study. we did phone interview, asking them a lot of questions about their symptoms. And then actually there is a second portion of the study because one of our co-investigator, Dr. Given, who is very well known in the oncology symptom management field, they have developed a symptom toolkits, mainly for cancer patients, but they're so gracious. They actually spend a few months revise these toolkits and that become COVID symptom related. So the second part of the study is asking those who have symptom and their symptom really bothering them, whether or not they would be interested in receiving this self-management toolkits. We send a hard copy to them. After 2 weeks, we call them and saying, have you had a chance to use that? And do you think it's helpful? Would you like to continue doing that? That kind of simple question to get a sense about acceptability of this toolkit. So today I'm going to share with you some of the important information we learned from the phone interview for symptoms, okay? Just some information, is not a lot. So I would like to share with you about 150 patients we talked to, in the past couple months. And those patients were infected by COVID-19 back in November 2020 to April 2021. Okay, if you recall, at that time, COVID vaccine is not available for most of the people in this country. Only the frontline person and some with like older as well as have chronic illness have the access to vaccination. So this sample present a very unique, I think most of them were infected when vaccination was not available to them. Also, this is way before Delta and Omicron variants. So I will refer this sample as original COVID samples. And among those 150 people we talked to, majority were female. And their average age was about 53 years old. But keep in mind, it's a long, we talked to everybody. The youngest was 21 and the oldest was 89. And actually, we asked them whether you were vaccinated or not. So I'm very happy to report to you the average. We have about 73% of our participants were vaccinated. It doesn't mean they were vaccinated when they were infected. Keep that in mind. I keep referring to that because it's very confusing. Majority were white, but we have about 23% are minority races. And most of them have a high school or greater than high school education. Actually, 78% has a greater than high school education. On average, they were infected about 11 months ago. 11 months ago, they got COVID. Okay. So I'm showing you some basic finding. So we found about 66% of the patients who reported at least one symptom, long COVID symptom. So remember, how do I define long COVID? Is infected more than 4 weeks ago, 4 weeks after. So again, think about this group of people we interviewed. They were infected, they were 11 months out. And 66%, they still experience at least one symptom. So this is a true long COVID. It's very sad. On average, people who were symptomatic, they have long COVID. They reported on average of 5 symptoms together. Okay, so it's ranged from 1 to 14 symptoms. We did talk to someone who had multiple symptoms the other day, actually not many weeks ago. 14 symptoms, they struggle. So this is our top 10 long COVID. So we use a very simple survey, basically asking them yes or no, whether we have that survey, including 21 symptoms, we believe probably related to long COVID, to COVID. as well as we leave one question open saying, is there any symptom we didn't ask? So there's 22 questions regarding their symptom in that symptom questionnaire. We ask yes or no, whether they have that or not. We ask severity. We also ask how do they perceive the interference with their daily life? Okay, so this is based on yes or no. So we call frequency or prevalence of the symptom. So the top 10 most common symptoms are fatigue, difficulty remembering things, joint pain or muscle pain, shortness of breath, sleep disturbance, and weakness, cough, loss of taste and smell, and anxiety, and so on. On your left-hand side, you will see a big, table, and there's giving you the percentage of those who reported their symptomatic, meaning, they report at least one symptom 11 months after. As you can see, fatigue, about half of those who are symptomatic, they have fatigue, followed by difficulty things, remembering things, foggy thought. And then I think pain, as well as short of breath, is still a big problem 11 months after. Sleep problem is very common. And also cough, no surprise. Loss of taste and smell. If you pay attention to, it's about a quarter of the survivor. They still have the problem with that. And then anxiety, as well as, there's a lot of things. I kind of want to point out two things to you: anxiety and depression, mental health. We all know the impact of COVID on mental health. Here, I'm showing you the number, which is very scary. It's scary because I think about a quarter of those who are symptomatic, they still feel depression and anxiety. I want to tell you this number is underestimated because one of our criteria to exclude the patient's participation if they are seeking mental health practitioner, if they're under the care of the mental health practitioner, they are excluded. So those who are really having the problem, we didn't interview because they're not eligible for our study. So anxiety and depression can be way more, problematic than our data is showing you, okay? Most severe: diarrhea, depression, sleep disturbance, anxiety, and nausea. This is based on 1 to 10 rating scale. 10 is the worst. So again, when you see the number, think about those numbers is pretty scary, I'm telling you. 1 to 10 severity. On average, well, diarrhea is the top one, but I want to tell you we only have 9 patients has a diarrhea, but their severity is probably the most severe among all. Although the number vary, but when you pay attention to, it's all 5 or 6, even those symptoms are not making to the top 10. Depression is very severe. Anxiety is very severe as well. I kind of tell you before, I'm an oncology researcher. The severity of those numbers is showing the severity of long COVID symptoms are compatible or even worse when you compare to those cancer patients going through chemo. This is how severe the symptoms are. And this is a big concern. I think there's going to be a lot of issues down the road. So we also asking them how those symptoms interfering with their daily life. Most interfering, again, this is from 1 to 10. 10 is the worst. The most bothersome symptoms including diarrhea, depression, weakness, sleep disturbance, joint pain, and as well as fatigue, and so on. When you look at the number, also it's very concerning. when you have that kind of bothersome or interfering with your daily life, think about long-term wise. I think it's going to be very, it becoming very burdensome. I think not only to the individual, to the family, I think to the society and the community as well. So this is just a recap. Our top 10 most commonly reported symptoms: fatigue, difficulty remembering things, joint pain and muscle pain, short of breath, sleep disturbance. Their severity is all 5 or above on 1 to 10 rating scale, as well as interference with their daily life. I don't know whether at this point you're curious about who have the symptom versus who are not. This is not really, we didn't do the statistical analysis yet. This is only the number to show you. We did notice among those who are symptomatic participants, I think female is, the majority is more than male. Again, I didn't do the analysis yet, so this is just giving you the number to show. It doesn't. I don't know whether it's statistically significant or not. Okay. The other question I was being asked a lot is whether vaccination help with long COVID. Among those who did not report symptoms, so they are asymptomatic, 68 or 69%, they said they have been vaccinated. Okay. So that's all my story today. Again, it's just a quick overview. I'm just showing you what we have learned so far, and there's more to come. And I thank you very much for your attention. And I want to tell you, this study we are very lucky. We're funded by Blue Cross Blue Shield of Michigan Foundation. And here is my email. If you have any questions, feel free to reach out.
Oh, Dr. Wu, we're so glad that for a number of things. Number one, that you came to share this important information with us. Number two, that you've agreed to come back as you learn more from your study and keep us informed, because it seems like this is just the tip of the iceberg of things that we're going to be learning. So we have some wonderful folks that join us every single week for our roundtable, actually. So I'm going to invite them as well as you, Dr. Wu. So stick around, because I'd like to continue this conversation about long COVID, what we need to do to prevent COVID, and just some things to keep in mind. So Dr. Wolford, Dr. Reynolds, I think Kaylee Blaney is on as well. Please join us in the roundtable.
I apologize from the onset. I'll put myself on mute because I have drilling going on outside. But I thank you very much, Dr. Wu. Sometimes I feel like a frog in a hole in the ground. I can only see the sky above my head, and you have really broadened our vision. And it's important that we take a step toward having a clinical picture. So one day we can start to classify exactly what we're looking at. So this was very enlightening.
Dr. Wolford, what are your thoughts on this, and what should we be thinking about doing as a community?
Well, I'd like to echo Dr. Reynolds' comments about how fabulous this presentation was. Thank you so much for sharing that information with us. I think that one of the things that strikes me about this is how needed it is to follow this over time, right? Because it all changes. And so as Dr. Wu pointed out, we're dealing with, or initially looking at the original variant or the original COVID, but now how does it change with various variants? And that has an impact, because I know, like in the news at one point, it was like, oh, Omicron causes, is less likely to cause long COVID than Delta. Well, maybe not, but that was also the original Omicron. So what happens with the more recent versions of Omicron? And even if it causes sort of, even if the odds of getting COVID may be less from certain variants, we know that it doesn't really cost our society anything less because these variants are more likely to infect a larger number of people. So you still have huge numbers of people who are being impacted by these symptoms. So I think that the research that was done was so incredibly important, and it's important to continue doing it, keeping those studies going and the surveillance going, so that we can have the information we need.
Thank you very much for the comment. And actually, I agree with you. And I kind of want to share with my experience with this study. It seems like we learn different things over time, and COVID changed over time.
Mm-hmm.
So at the beginning of our study, we never thought about there will be a very, well, actually, when we started, it's about, well, that is right before the Delta variant, because we started the data collection back in, I believe it's September, August last year. There was no Delta. We didn't know there would be a variant. And then all of a sudden, Delta started and Omicron after that, you know. So our original plan is simply think about, well, we are just collecting data from those who were being infected by COVID. It turned out the new wave came up after we started. So I'm very happy to tell you what you raise is a very important question, because a lot of people, I don't know whether it's based on the certain kind of data, or they just say, I don't know what the base are, but I did hear what people say. Omicron seems like it's less severe, or maybe you will be okay after you got infected. It's just like a flu, you will be okay. So the good news is we are currently collecting the second cohort. Is right. We started September. That new cohort is September 2021 to January 2022. As you recall, that is when we have Delta and Omicron. So we make a decision about adding another group, because I think once we finish that group, we will be able to compare the original group versus the Omicron and Delta variant. I think it will be very interesting to know what's going on, you know, whether they are doing better or not. So stay tuned.
Absolutely.
I think from a public health perspective too, when you look at studies like this, especially knowing that an Omicron specific vaccine is supposedly coming out late this summer or early this fall, information on studies like this help when you're having conversations with folks who are weighing, do I want to get vaccinated? Do I not want to get vaccinated? It allows people to make more informed decisions, because right now people are really just thinking about, I don't want to be sick for 5 days. But this research shows that there's a possibility you could be sick for a lot more than 5 days, which might change people's decision making on getting vaccinated versus not getting vaccinated. Knowing the full picture of this might not just be a 5-day thing, this could be a year-long, two-year-long, depending on your age, a potentially lifelong issue. So I think studies like this give people a lot more information with which to make their decisions.
Thank you. I totally agree. And actually, I have been asked by a lot of people whether vaccination really help with the long COVID. And unfortunately, I don't have the answer yet, because like I said, when we started, only the vaccination is available. So we did have a question whether you're vaccinated or not. Later on, there's a booster, and then there's various kind of things. Now we have a new one. So we actually, in the middle of the study, we did change our questionnaire, becoming more specific. In addition to whether you were vaccinated or not, yes or no, whether you have a booster, first and second booster. And then also we ask a question that will be very important down the road is, were you vaccinated when you got infected? I think that information is going to provide us a lot of valuable information. And so unfortunately, this older cohort, that the original cohort I presented the information to you today, is I have to take a look about the data, whether how many patients we interview after we change the protocol, adding that questions for, whether you were vaccinated when you got infected or not. But maybe later on I can share with you about the information. You're totally right. I told my friends and my family, I am afraid to be infected because I cannot be, well, maybe you will recover, but I cannot afford to have a long-term impact on my life because, who can afford to live? You're so fatigued. You cannot think. You have you have trouble remembering or foggy thought. I just cannot afford being like that. And I agree with you. I think this information really need to, I think we need to disseminate this piece of the information so people is not going to take it, can be more careful about being, whether you're infected by COVID or not.
Absolutely. I think it's like playing Russian roulette. I mean, you just don't know if it's going to be you. But if it is, the outcome is so incredibly difficult to live with. As I think it was really striking in your presentation that people, the symptoms, though, the way in which, or the severity to which they reported these symptoms was comparable with people who have cancer. I mean, chronic pain and chronic symptoms are no fun. In a very, very small way, I remember having a toothache for a year, and nobody could work out why I had this toothache for a year. And I remember thinking to myself, am I going to have to live the rest of my life in pain? I'm in a meeting, people are asking me questions, all I can think about is the pain. I'm trying to see a patient, all I can think about is the pain, and nothing is controlling it. And it's a horrible, horrible thought. And to think that you can do something to avoid that risk of developing these long symptoms. To me, I think it definitely weighs on the side of doing everything you can and doing all those layers that Dr. Reynolds will mention to help not get long COVID.
And I think it presents policy issues because when we look at disability, SSI, people are quick to dismiss the findings that are listed without validation from work like yours. And we talk about long COVID. Yes, it's long COVID. And we as a society have to be prepared for that.
Actually last year, yes, I think last year, probably around December, that was the first time we did analysis and just a preliminary analysis. As soon as we saw the severity, the number, it was a big, shock for us because we study cancer and we know how hard to go through chemotherapy. But when you see the severity of those people reported, it's just terrifying. Especially if, I don't know whether you pay attention to that, there's a small number next to that is that we call standard deviation. It's just telling you how homogeneous those people are. We did the standard deviation is like 1 or 2 for those severity score, meaning between, its rating is 10, like 1 to 10, and we got that small variation, meaning if they have that symptom, most of them, majority of them are very severe. And that part is kind of concerning. And I totally agree with you. At that time, we were thinking about, if they become long-term, those people are going to be disabled. They won't be able to back to their normal life. I cannot imagine they continuing working as they used to be. So that can be a concern. That can be a great impact down the road for our society as a whole.
So much. I saw Nurse T joined us this week. And so we have to get her perspective.
I think the presentation and the information was very informative, especially when you was talking about anxiety. I know a lot of time I've been educating in the community about vaccination hesitation. And one of the things that we were talking about, which a lot of people probably overlooked, was being at the grocery store. If you are an introvert versus an extrovert, how introverts, they kind of stay to themselves, but extroverts, they like to talk to people, and how stressful it is to be in the front of the line of the grocery store and to not be able to turn around and talk to the people behind you Or if you are turning around to talk to the people behind you, you're reminding them about 6 feet. And as well as the stress that it creates when you're in the stores or you're anywhere and you have been vaccinated and you know it's flu season or you have allergies and then you have that cough, and how the community feel when they're cough. They're scared to cough when we know that cough, you know, it helps, it clears our throat. But a lot of times the community, they said that they were afraid to cough. So I think it's a lot of simple communications and strategies that we gotta have conversations with the community, because the anxiety is high. And I know like right now at Hurley, we've been admitting a lot of patients, but the thing about it is we've been admitting a lot of patients with underlying medical conditions who incidentally are found to be positive for COVID. So now some of the patients that's coming in, they're not coming in because they are thinking that they have signs and symptoms. It's their medical conditions that's bringing them in, and we test them and they're positive. So it's just a struggle all the way around, a new norm. You know, we just really have to stay connected, educated, and, you know, continue to know that it's another layer of protection and address the community with their fears and concerns.
I totally agree. And I appreciate you mentioned mental health, like depression, anxiety, because it's standing out is a big problem. We heard over time from the, you know, I listened to a radio, a lot of time the TV is saying the mental health and COVID. I think we are still underestimate the impact of our mental health problem. And although I show you the data we have, like, you know, of course, anxiety, depression is on the top, and the severity, 5 or 6, it's terrible. You know, it's 5 or 6. It's really clinically significant. But I also want to mention we underestimate that, because let me give you a number. So we, among this cohort, we basically get agreement, like we talk to the patient, whether they want to consider, and then there are 217 individual, we did a screening. Among those 217, 38, which is about 18%, close to be 20%, they were currently seeking help or under the care of mental health practitioner. And they said it's COVID related. They did not have the problem before. Just because of COVID, they have mental health issue. They started seeing the mental health care practitioner. So the number we have, I just show you today, is totally underestimated, because I didn't talk to those 38 patients. I believe if I talk to them, it will add up the number, and maybe that become the most severe or probably the most common one. So mental health is something we really need to work on, I believe.
Yeah, and I was just gonna say, in regards to the healthcare workers, the nurses, the physicians, you know, a lot of us that were there right there when COVID started. I remember getting a call having to transition my unit into a COVID unit. I mean, the anxiety and the stress that we still remember, not being able to go home to our loved ones, or the guilt that we feel for caring for patients, and then we caught COVID and the fear of taking it home to our loved ones. So we have the community residents that's anxious, and we also still have the stress of healthcare workers that work directly caring for COVID patients. You know, the other day, I heard, you know, who would want to be a nurse, or who would want to be a healthcare provider? And this was just, you know, while I was at the nail salon, but I had to turn around and say, you know, we take our job serious. This is a great time to be a healthcare provider. You know, it's just what we signed up to do, but it doesn't mean that we wasn't mentally, emotionally, and physically impacted as well. So we just have to consider both sides, because a lot of nurses, physicians, they are on medications and seeking help as well, just to be able to maintain their day-to-day and in their profession.
Such good information. Thank you all for joining us. Again, this is a hard message to take, right? This is very sobering, but we do know that by having this information, it can then encourage us to make the right decisions to take care of ourselves, and also encourage others to practice the protocols, practice those elements that will keep us safe with masking, social distancing, don't touch our face, wash our hands, all of those things that we've known from the very beginning. So thank you all for joining us. Dr. Wu, we'll look forward to having you come back, share more as you find out more, and keep us informed. So with that, we're going to keep this going, and we're going to move on to hear from Dr. Rick Sadler. Rick is an associate professor in the Division of Public Health, and he's going to talk to us about some data and maps and all sorts of things.
Yeah, thank you. So I'm going to do two things today. One is the standard COVID case rundown with our visualizations, where we're breaking down by geography and by race and by week. And then from there, I'll get a little bit more into some map stuff. And I deliberately used a couple of the funny names for maps just to maybe spook you or excite you or get your attention at least. But I'm really not going to be using that much technical language, and really just trying to break down a couple of the many ways that we can leverage maps to communicate information, and how some of them can be confusing if you don't have kind of the right data behind it. So real quick, with respect to case counts, we did see an increase in Genesee County this week, but in the city of Flint, there was a slight decrease. Again, though, these numbers are so much lower than they were in the March-April peak, that some of this kind of increase and decrease week to week can be attributable to noise. However, there was still an increase in the testing positivity rate from 15.2 to 16.7. So that's all I'm going to say about COVID specifically this week, or at least contemporary cases. But I wanted to show you a few different kinds of maps. And so I have an intro slide here that I'll go through a few things, and then I'll get to the different kinds of COVID maps. So yeah, I'm saying cartograms and choropleths. Oh my, like lions, tigers, and bears. These are just fancy words for a couple different kinds of maps. And in fact, there is a cartogram and a choropleth in the bottom right of this slide. But I'm just going to try to help you get to know some basics. Now, the reason we show these different kinds of maps, that we like to illustrate different types of maps, is that, well, and I'll get to this more in the next slide, but when we look at COVID cases, for example, if we're looking at the exact location of where people have COVID, or the number of people who have COVID by city or township or zip code or something like that, they can be visualized, symbolized in different ways. And if you have a big empty township, like a rural township where 25 people live, and you have a dense city that's a tenth as big, but it has 2,000 people in it, if you're trying to represent the severity of COVID in a big geography that only has 25 people, or a little geography that has 2,000 people, you have to kind of do some special things to account for that. You don't want to always just show the sheer number of people. Anyway, so with respect to these maps, I do want to say maps can lie, just like statistics. So it's something that I, as a cartographer, am definitely aware of. Anytime I'm making a map, trying to visualize more accurately or most accurately what is reality. So I want to highlight that maps can be messier than maybe they should be because of a couple different things. One is when we have privacy issues that require that we make cases anonymous. So we can never just put points on a map when it comes to health information, because that's a protected piece of information. So we need to either create like a density map that kind of shows the relative location of these, or we need to connect points to something like a zip code or a city, and then figure out how to visualize from there. Another way that maps can be messier is that like I was talking about, we have this uneven population density. So more people live in cities than in rural areas. And this is the example at the right that I'm going to get to in just a second. And then also maps can be messy because we have uneven populations in those zip codes and census tracts and cities. So if we had zip codes where every zip code was 10,000 people, maybe it would be easier to make a map that showed the number of people with COVID, or the number of people with a college degree, or the number of people who like pizza or whatever. So the two maps in the bottom right-hand side here, one of these is a cartogram. The cartogram is the funky shaped map. And so what that's doing is it's making the size of all of these counties correspond to the number of people who live there. And the little map in the upper right of this US presidential election figure is a more simple choropleth map. And so the difference between these two maps is that when you look at the littler map that looks like the US, it looks like there's a bunch of red all throughout the middle of the US. And again, this is the presidential election, so red corresponds to Republican votes, blue to Democratic votes. But when you visualize it as a cartogram, and again, it gets funky, and I'm not trying to be overly technical, you can really see how the popular vote was majority blue in the 2020 election. And it's because way more people live in these urban counties on the East Coast, in the Midwest, and on the West Coast than in all those tiny little counties through the Great Plains and in the South. And so these can be useful for communicating the actual impacts or the actual outcome of an election in this case. And so we haven't made any cartograms with COVID cases because it's a little bit technical and a little bit funky for our purposes locally. So I don't make those, but I do other things with maps to try to convey that sometimes, even though there might be a bunch of cases somewhere, when you look at the number of cases as a percentage of the population, it's not as big of a deal. So I have three maps on the next page here, or the next slide here. And these are my three little maps for today. And they're showing three different visualizations of the same basic thing. One is the number of COVID cases by census tract. And so these are different sizes, and they're designated by the census. And so we have the case counts here ranging from 15 in a census tract up to about 504 in one of the census tracts. And then we have the density of COVID cases. And we've shown these a number of times. And this density map can be a little misleading because it's really usually tracking where most people live. So it's really a population density map. And then the third map is a kind of map that I prefer, which is showing the percentage of people who have or have had COVID. And in this case, this map is showing the percentage of people who've gotten COVID post vaccine rollout. So like basically post April, May of 2021. And so Heather, if you could click the first three circles. So I have 9 circles here I'm going to show. These first 3 are showing more or less the same neighborhood. I think I got the one off a little bit. But so if you look in the northeast corner of what we say is Flushing Township, if you look at the number of cases by tract, it shows up as like maybe not so many, right? However, with looking at the data inside it, we know that that census tract doesn't have a ton of people in it. And so if you look at the density of COVID cases, it shows up as pretty low. And that's that second circle. But if you look to the right, the percentage of people who had COVID, it's actually quite high. So there's not a lot of people who live in that census tract. So when you look at it by percentage, it's actually more helpful for visualizing really what the experience is on the ground. And so another example with the next 3 circles is looking at the neighborhood just east of downtown Flint around Mott Community College. And so in this case, again, you have a relatively low number of COVID cases on the left, but you have a relatively high density of COVID cases. But that's just because there's a lot of people who live in that neighborhood. And so when you look at the percentage of people with COVID on the right-hand side, it's actually one of the lowest percentage cases in the county. And in fact, if you look at the city overall on the right-hand side map, the city of Flint doesn't have many hotspots or places where there's been a high percentage of people getting COVID post-vaccine rollout. And then my last example is one of the southern census tracts in Mundy Township. And so you see, it looks like there's a lot of COVID cases, but this is a tract that just has a lot of people living in it, but they're all spread out. So the density isn't showing up. And when you look at the percentage of people with COVID, it's kind of in the middle. So the kind of what I want to convey here is knowing how many people live in a neighborhood or a census tract or a zip code, and knowing how big that neighborhood is, are both important factors in deciding what map you might want to make and how you'd want to show that information. So all that to say, the map at the right, the percentage of people with COVID, for me, is a preferred map for a lot of communication purposes, because it really lets us see those higher areas in darker red shade are places where a higher percentage of people have got COVID. And that is ultimately more concerning than the number of cases by some geography, or just looking at the density of cases. That's what I have for you today.
Yeah, it's wonderful, Rick. Thank you so much, because just because you see a map, you have to be very careful with what you're reading into it, what it's actually telling you. So thank you for helping us understand what we should be aware of as we look at maps.
Yeah.
All right, we're moving on with our webinar here. So we have Ashley, who is the Emergency Preparedness Coordinator. She's got a couple updates for us. Beginning with, we're going to be hitting some hot weather, Ashley. So you've got some ways to take care of folks, right?
Absolutely. So Metro Community Development forward on cooling centers. Sorry, you guys caught me on the go within Genesee County, just to kind of for our vulnerable populations. So those are all listed on the slide here. Thankfully, this is recorded, so it can be referenced at a later time. These centers are available for those that need reprieve from the heat, so to speak. You know, if you do have a fan in your house, just keep in mind that you're hot and you don't have a way to circulate. Just being mindful of, while you may have a resource that you think is viable, just be mindful of your settings and whether or not it is efficient to keep you cool. As well as staying hydrated, keep drinking that cold water, make sure that your body has what it needs to stay cool as the temperatures continue to rise or stay high.
And we can find this information on the health department's website, right? We've got
Yes.
Carriagetown, Oak Street, Hasselbring, Center of Hope, North End Soup Kitchen, Burton Senior Center, and the Brennan Senior Center, excuse me.
You are correct. At this time, we are monitoring the weather, so we're not under a public health emergency for the heat at this time. So there are no emergency resources or shelters in place. Those would be updated on our website for long-term displacement for the weather. So these are going to be our locations. Please be mindful of the times that they are open. They may change as we continue through the season, but that's just definitely something that we'll have to keep in mind. And that it is found on the website. I believe our data analyst is working on making sure that stays up to date.
All right, we also have our vaccination sites. You've got our map with the upcoming pop-up clinics and our regularly established clinics. And that's also available on the website. So it looks like we've got the East Side Mission that you've got about an hour left if you want to head to that vaccination clinic
Yes.
for this week. And then next week you'll be back at Central, and then another pop-up on Friday of next week.
Actually, so Hasselbring is going to be today, the 15th from 4 to 6. I get it. And then Eastside Mission is a Saturday pop-up clinic with Michigan United from 12 to 2. Being mindful of the age parameters that are listed for each clinic. That one is 12 and up. So if you have any little humans that are under the age of 12, they're not going to get vaccinated there.
Good to know. Then we have our regular vaccination sites. That information is there for you also at the health department's website. Testing locations, don't forget about those three. Those have not changed and are still available for you. And then finally, we have Walgreens, Hamilton, Rite Aid, continuing their vaccination sites, and then additional support always. Right, Ashley, we can just reach out to the health department. And what else do we need to keep in mind if we do a home test? We
do a home test. You are welcome to, you're not required to, but you are recommended and welcome to report your positive test. If you go to our website, gchd.us, right in the center of the page, it says if you want to report a home positive test, please do so here. You click on that link. If you have barriers to navigating our website or barriers to access to the internet, you're always welcome to call our COVID call center. It's 810-344-4800. Again, we still ask that you please reserve our phone lines for those that are unable to use online resources. And we do have information available in English and Spanish.
Always so grateful when you can join us, even on the run,
Yeah.
going from thing to thing, supporting our community. So thank you for that.
Yeah,
Up
there's a lot
next-
going on.
All right, we do have Kiana Towns-Williams from the city of Flint. She's got some quick updates for us today. Kiana, lots of stuff going on in the city.
Indeed. Thank you for that. Good job today, Heatherlyn. Good afternoon, everybody. Just a few updates from the city of Flint. I hope you all are having a great Friday. Wanted to start with this historic education budget. So on yesterday, Governor Gretchen Whitmer came to Flint at Mott Community College in the Regional Tech building to announce or to sign the budget, $19.1 billion going into the education budget. For us in Michigan, that's a $450 increase per student. That budget also includes $1.92 billion for special education programs. And so we had the opportunity to be present for that historic signing, looking forward to all of the great things that we'll be able to do to support our students in that process. If you want any more information on that, we do have a longer posting of detailed information at the City of Flint's Facebook page, and you can check it out there. Just one other thing to note from yesterday, Racer Trust held an informational meeting, and we know that Racer has oversight of the Buick City site here in Flint, and they provided yesterday an update to the community. That update was recorded. The address where you can find it and watch it and be current on what's happening at that location as it relates to any issues or, excuse me, any concerns related to any pollution at that site, you can go to racertrust.org/Buick City 18, and the full recording of the event is there for you to watch. Exciting things happening in Flint. Last week, Mayor Neely dedicated the main office of the 12th Street Maintenance Garage to the memory of Miss Betty Weidman. She worked for the city of Flint for quite some time. And in 2020, we did lose her to COVID. And she was just a wonderful, very hardworking, very well liked individual here at the city of Flint, and will be missed. So when you ride by and you see the building, send your hearts out to her family and friends, and all the best to Miss Betty. More exciting news, Mr. Joe Davis Jr. will be on site really soon for the naming of the renaming of the fire station here at 5th in his honor. Mr. Davis was the first African-American firefighter in the city of Flint. He served the city for a substantial amount of time, and this honor is very well deserved. The details on that are forthcoming, so once we have the information on when the ceremony will be held, we'll go ahead and share that. And then just a reminder, this is up on the website as well. Monday through Thursday, there are all kinds of outdoor exercises we can do together, sponsored by What's Up Downtown Flint and the DDA and CRIMP and several other organizations. So be on the lookout for that. Come on out, exercise with us, and have fun.
We always love having you join us, Kiana. Thank you so much for that great information. We would be remiss if we didn't remind you about the research symposium, the Hfrcc's research symposium, which is coming up Friday, February 30th, but we've extended the deadline for abstracts. So if you or someone you know is doing some research and you'd like to talk about it, get those abstracts submitted through the Hfrcc website. We also have one last quick announcement from Nina Lewis, who is the outreach coordinator for the Hfrcc.
Hi, Heather Lynn. Thank you so much. I'm going to go ahead and put the registration link. And it muted me again. Okay, I'll put the registration link for this event in the chat. This is the MSU Community Apathon, and the Hfrcc Community Corps has partnered with MSU to bring this to the city of Flint. As you can see, it's a collaborative in which Flint community members will be able to work together and develop some web apps that'll help promote health equity in the city of Flint. So this is happening next weekend, the 22nd through the 24th. You can sign up. This is a free event. Anyone who lives in Flint and is over the age of 18 is eligible to be a part, and participants can earn up to $150 in gift cards for joining us. Breakfast, lunch, and a snack will be provided on Saturday, Friday, and Sundays. Events will be virtual. You can always find out more information on this event at the Hfrcc website. It's hfrcc.org. Thank you.
All right. Thanks, Nina. Social workers, community health workers, you have our hearts. We love you so much and the work that you do. Don't forget to sign up for those continuing education units. And as always, like us on Facebook, subscribe to the YouTube channel, email us, and give us a call. And we'll look forward to having you join us next week. So this has been a wonderful webinar, lots of great information and great conversations that you can continue with those that you love and those that you care about. So thank you again.